Carly, we've heard a bit about prevention, and there obviously is some value in prevention, but it's not the only message by any means. What are your thoughts on screening for lung cancer? Should we be screening everybody? And if not, who should we screen? Who should we focus our resources on?
Well, screening tests are based on science and data, as they should be, because screening tests have risks as well as benefits. I completely understand the gut reaction to want to screen everyone. My father's a lung cancer survivor. I lost my grandmother to lung cancer. I had my childhood home tested for radon when I started working at the American Lung Association. We had really high levels. So I'm concerned about my risk. I get it, but I do not meet the high-risk criteria for screening. That can be hard to swallow, but you have to keep in mind that, we want lung cancer screening to detect lung cancer early in those that are high risk, to save lives, to reduce mortality. That is the goal, and that is not going to be true for everyone. So those that meet the high-risk criteria, that are over 55, have a 30-year PAC history of smoking, or are current smokers or have quit within the past 15 years, if you meet those criteria, you absolutely should talk to your doctor about getting screened. I can understand it can be frustrating if you don't meet those criteria and you are concerned. You can talk to your doctor and say, what do you think? Let's discuss this. But to know that until we have data that shows that that's beneficial for people outside of the high-risk criteria, it's really not, something that's recommended.
Just to wrap up the segment, Dr. Horn, we've heard some great points here from Carly about those patients in high-risk categories. Go to your doctor, discuss this. But in reality, if a patient goes to their primary care doctor and says, I'm concerned about the risk of lung cancer and these are the reasons I'm concerned, do you think that patients get good advice about whether they should or should not be screened from their primary care? Or do you hear lots of stories where you think, we could have really jumped on this much sooner for patients who end up in your office with a diagnosis of lung cancer and possibly a delayed diagnosis?
So you often hear about the delayed diagnosis. You hear about that patient, you can almost have the script before you meet them of, I had a cough, my primary care doctor gave me some antibiotics and steroids and I didn't get better. So they got another round of antibiotics and steroids and it didn't get better. And then 2 or 3 months into their symptoms, they finally get that chest x-ray or that CT scan. That's a really common story in our never smoking patients or our younger patients. We've got a very active screening program, and so our primary care doctors, and we actually have a screening clinic that are screening all those high-risk patients. So it depends on how that's penetrated into the different communities in terms of lung cancer screening. But for most of the patients that I see, they have that story of, I had symptoms for several months before that scan was done that finally led to that diagnosis.
And I think that's one of the issues, Chris. We hear so much now about how specialised doctors have become, and specialists know a lot about a little, and primary care doctors know a little about a lot. It's not just about educating people in the community, but also we have to educate our own profession, don't we? Educate doctors, primary care doctors, and many patients end up in urgent care where they don't necessarily have a regular doctor. Do you think that's an issue?
I think it's a huge issue. I think as we're evolving, and we talked about it before in terms of medical oncologists that are not specific as lung docs, making sure that we educate them and make sure that they know, what's top of the line in terms of care, but also with primary care docs. We need to love them. We need to care about them because they're the front line. When we look at diagnosis, they have to believe that it could be somebody. Like my wife that's 37 years old, they have to believe that so that they don't delay when they could potentially do a chest x-ray or they end up doing a CT scan. Because they don't even do the chest x-ray in most cases. My wife's primary care doc, he did it, right? And that's how we found that she had a mass in her lung. Now, the other part is when we look at screening, it is, you heard the criteria, Carly laid it out. But the biggest group within that are vets. They're vets. There are people that put their lives on the line. There are people that, yes, they smoke, but you know why they smoke. They were giving them cigarettes. They're giving them out like candy, right? These people put their lives on the line for us, and we got to take care of them.
And maybe those patients are exposed to other environmental risk factors that the general population may not be exposed to, and maybe they need even better care because of the risks that they may be exposed to.